don't get blinded by the light from fame. We're all ordinary people at the end of the day. We make decisions, some good, some bad, but we all pushing for things we never had.
Ordinary people with extraordinary ways.
Yeah.
Everyday people trying to make a way.
It's just us.
Ordinary people with extraordinary ways.
Yeah.
Trying to make a difference step by step each day. It's just us.
Hi, I'm Charlene. Welcome to It's Just Us. If you've been following the show, you know that we've been focusing a lot on our health, and we're going to do that again today on this show. Joining me later on in this show, we'll be talking about female sexual dysfunction. But right now, we're going to speak with Shauna and Dr. Barker in relations to coronary artery disease. Shauna, can you tell us about your story and how your diagnosis and your research led to your treatment plan?
Sure. Earlier this year, I experienced symptoms while working out. I'm extremely active, and I work out every day. I walk my dog a couple of miles every day, and it was, within one of those activities that I had symptoms that I literally had never experienced before. I had tightness in my neck and my throat, a tightness in my left side of my chest. I had numbness that ran down my left arm, and it was literally symptoms that kind of stopped me in my tracks because it just was something so out of the ordinary. I was given medication, to treat coronary artery disease and angina, but after a while I still had breakthrough symptoms. I felt like I didn't quite have the answer that I wanted, which was where's this coming from and what's the cause of it. And on one particular day, my symptoms were extremely severe. And through a referral, I saw Dr. Barker that very day. And I was literally astounded to learn that I had a 90% blockage of a major artery that was causing all these symptoms. And within hours, I was in a cath lab, and I had a stent implanted, which was a Synergy stent. It restored the blood flow. I mean, within minutes, I absolutely felt better. And I had very little restrictions the first week, and I was back walking several miles. And a few weeks after that, I was back to all my working out, and Dr. Barker said I had no restrictions, and I really felt like I had my life back.
Thank you for that, Shauna. So, Dr. Barker, what kind of questions should patients like Shauna ask when preparing for a procedure?
Yeah, I think there are several important questions. One, and first and foremost, anytime someone's telling you you're going for some sort of invasive procedure like a heart stent, you want to understand why. What am I getting out of it? What are the benefits? And there are really two circumstances where a heart stent could be helpful. One is in a patient like Shauna, who's healthy and really doing all the right things and taking the right medications, but still having lifestyle disrupting symptoms and chest pain and chest pressure. And in that case, going and putting a stent in to relieve the obstruction can lead to normal blood flow in the heart and have you feeling better. The other circumstance is when someone presents with a heart attack, a stent in that situation can really be life-saving. The flip side to that, and the important question to ask for any invasive procedure, is what are the risks? What are the potential downsides? Stenting procedures and technology have come a long way where they are very safe, but there's still a 1% risk of a complication anytime you go for an invasive heart procedure. And lastly, you want to understand how many of these procedures your doctor or your hospital has done. You want to make sure you're at a center that does a lot of these, therefore becomes a much safer procedure.
So, Dr. Barker, you mentioned technology. So how has technology changed throughout the years, and what does this change mean for patients?
It's come a long way to where it's very safe and effective. Years ago, we used just simple balloons to open arteries, and there was a 50-50 chance that the artery would stay open. 20 years ago, we started putting in metal scaffolds, which is what a stent is, to prop the artery open but also keep it open. But there was about a 25% chance that scar tissue would develop and the artery would become narrowed again. So 10 years ago, we started putting medication on the stents to prevent this scar tissue buildup, but there was a slight risk of a heart attack with these original medicated stents. So now, in the current technology, including the Synergy stent made by Boston Scientific, who we're partnering with today, There's medication on the stent to prevent the scar tissue buildup, but there's also a coating that allows the artery to heal without this risk of developing a heart attack, and it dissolves over a few months, so that by 3 to 6 months you're really safe as far as having a stent keeping the artery open with very little chance of it re-narrowing from scar tissue, and almost close to zero chance of it having a heart attack in that area. So that's really beneficial for someone like Shauna, who we expect to go have a very healthy, long life, and now has a device in place that's essentially healed by now, and she's back to having a normal artery.
That's great. So Shauna, what do you want people to learn from your personal story?
You know, I just think that I'm someone that didn't think this could happen to me, and I know there are a lot of people just like me that don't think they have any risk factors for coronary artery disease, and you just need to, you know, pay attention to symptoms that are out of the ordinary. Be your own advocate, be your own best, you know, patient advocate.
Thank you so much, Shauna and Dr. Barker, for speaking with me today.
Thank you.
Thank you.
Joining me now is Dr. Leah Millhiser, and we're going to discuss women's sexual dysfunction. Dr. Millhiser, thank you so much for joining me, and let's just start here. How important is it for women to have a healthy sex life?
You know, it's really incredibly important for women. If you look at the women who come to my practice, and I practice sexual medicine, they'll tell me that their sexual function is as important as other aspects of their overall health and wellness. So they want their healthcare provider to talk to them about it, because sometimes things don't always go the way they want when it comes to sexual function. Take, for example, sexual desire. We know that when a woman, and we know this through research, that when a woman experiences low sexual desire, it's like having these tentacles that sort of enter every area of her function in her life. It affects her relationship, it affects her self-esteem and her body image, which then can lead to an impact of her performance at work, her interactions with her friends and her family.
So women not feeling in the mood, could that be a sign of a medical condition?
You know, it could be. I like to break this up into two buckets. You know, you've got women who are, listen, their sex drive waxes and wanes throughout their life. This could be from, you've got young kids at home, you're working, you're a multitasker, you're stressed and fatigued, you're going through menopause, breastfeeding, whatever it could be, you're going to have changes in your sexual function. Now, again, you'll have lows and you'll have highs, and women typically learn to sort of work through those, but sometimes those sexual function concerns will not get better. In fact, they become chronic. They're persistent. You don't see those, sometimes it's good, sometimes it's bad. You see, it's mostly low or absent.
So Dr. Millhiser, how do you suggest that a woman starts having this conversation, especially with her partner?
You know, that's a really great question. A lot of women they're afraid to talk to their partner about it. They're afraid to talk to their healthcare provider about it. Being open and honest with your partner about what you're experiencing is the most important first step a woman can take. Your partner is there to support you. If they understand that you're experiencing these changes in your sexual function, they're going to be your support to help you find a provider who will give you a solution to deal with these issues. So there's a great website that a woman can go to. It's called findmyspark.com. This was created by the American Sexual Health Association and supported by Valiant. And what they did is they brought together a group of female sexual medicine experts to create tools and resources that women can refer to that will tell them, what is female sexual dysfunction? How do I know I may have it? How do I speak to my healthcare provider about it? Is it even okay to bring up the conversation? So it's a really good place to go. It also helps women in teaching them how to speak to their partner about this issue. Because, you know, if a woman's in a partnership, the sexual dysfunction is not going to exist in isolation. She needs to find a way to be open. So findmyspark.com is a great stepping off point for women. And then, of course, make that appointment with your healthcare provider. They want to know if there is a concern or a problem in your sexual health, Because not only is it important for your overall health and well-being, it may be a sign of another underlying medical disorder. So they really need to know if there's a concern. So doctor, what is the biggest takeaway for women on this issue? Yeah, I think the biggest takeaway is you're not alone. There are treatment solutions available to you, both medical and psychological. But the first step has got to be open up to your healthcare provider to get the care that you need. And go to findmyspark.com. It really will help give you the tools to start that conversation. This is really great information, doctor. Thank you so much for coming on the show today. Thank you so much for having me. Hey, you got 5 minutes? Let's talk about chili. Temperatures dropping, it's getting chilly outside, so why not make a bowl of chili? Joining me to discuss this topic is Chef Jeffrey Saad of the United Tastes of America. Chef, welcome to It's Just Us. I must admit, though, I think about chili a lot more than I prepare chili, so what is it about chili that makes it a family favorite?
Yeah, I think it is a family favorite because it's a one-pot dish. You know, it's easy for mom or dad because you just stir everything together, bring it to a boil if you want it to be that simple, and it's going to be delicious. But it's also a pot of memories and experiences because everybody makes their own version of chili. Whether it's their mom's recipe or their favorite TV chef, there's inspiration in chili. And it's so customizable. So I think once people get started with the basics, they're going to really be excited about expanding their chili repertoire. And as the weather starts to change, you know, it gets cooler, it's such a natural thing to eat. And that makes sense because it's part of building yet another tradition in our families. Exactly. That's what food's all about. That's what I love about it. Yeah. So what are the most popular ways to make chili? Well, I always say start with the base and then kind of launch from there. So these are great bases. We've got a white chili chicken, which is even nice in the summer. And color matters, right? If it's a white chili, a light chili, it just seems lighter. And it's interesting what you can put on top, and we'll talk about that in a minute. And this is thickened with actually a cream of chicken soup. So that's a fun way to add flavor quickly. Then we've got a kidney bean chili, which is very much thought of as kind of traditional, big hearty red kidney beans. And then here's a black bean chili, which is vegetarian, although you'd be halfway through it and not even say, oh, where's the meat? Because it's so hearty with the addition of kidney beans. Because I'm inspired by ingredients, and I love the beans and I love good chilies. But then you say, okay, now how are we going to customize it? How does each person get to have a great chili experience? And how do I stay inspired as the cook? Sometimes you don't have time, you want to whip it together. Other times you want to spend a few hours on it. So one idea is to take your sour creams and mix things in. Add a little bit of paprika. You have this big bright red sour cream and you dollop that on top. And then maybe you sprinkle it with a little bit of dried thyme so it looks beautiful. And then think about the farmer's market. If you see some beautiful kale, saute that up with a little bit of lemon juice, chili flakes, and olive oil. You can save some of it for a pasta tomorrow, but you can stir the rest into the chili and you'll get great color. Adding things at the end, layering flavors along the way, those are all great ways to make chili delicious. Even searing the meats and the onions before you start adding the beans and the liquids. So in thinking about this being possibly a new family tradition, how can families engage younger children in the process? Yeah, I think kids are so amazing. And I've learned from cooking with my kids since they were little. They're now older, but they loved getting involved in making choices, right? Don't just, go get me the beans. Which beans do you want to use? I'd pop open 3 or 4 cans, let them taste and say, oh, I like these. Can we put both in, Mom? Yeah, let's put them all. And you won't go wrong. So let them be active in the choice. Show them, how to saute the meat, have them smell the herbs and pick the herb they want, chop that up, put it in the meat, put some on the side. Let them get involved. And the more they're involved, the more they'll be inspired to eat well and to cook and to enjoy food as part of life like we all do. Yeah, great. So, Chef, where can we get more recipe inspiration and information? Yeah, absolutely. Thanks for asking. If you go to bushbeans.com, I've partnered up with these guys to create some delicious recipes, some great tips and techniques, and just, in general, nice meal planning. So check it out and you'll be thoroughly inspired. Whether you're a brand new cook or a chili expert, I think you'll love it. Got it. Thank you for those 5 minutes. You bet, Charlene. Let's get cooking. Have a great day. And I want to thank you for joining us. For more information about It's Just Us, please visit our website at itsjustustalkshow.com. All of our links to social media on the site. Please reach out to us. We love hearing from you. Until next time, I hope that you will continue to happen to life. Take care.